Coronavirus headlines. A ninth person here in Montana is confirmed to have coronavirus. The new patient is a man in his 20s in Gallatin County, according to the Gallatin City County Health Department. They said he's in good condition at his home. A Gallatin County health officer said the man returned to Montana from Europe on March 12th and had symptoms of the virus. He was tested on March 13th and the results came back Tuesday. Health leaders say the man was diligent in self-isolating, saving many potential contacts and exposures. There are 8 other confirmed cases in Montana, and another Montanan is confirmed to have coronavirus. She was tested in Maryland, where she lives. She has no documented exposures or close contacts here in Montana. And new this morning, Cascade County health leaders now have a new task force dedicated to developing more guidance in the event that more businesses close due to coronavirus concerns. On Tuesday night, officials met with business leaders to discuss the coronavirus and its potential effect on the restaurant industry. They determined not to close businesses in the county at this time. Still, Trish Gardner with CCHD says measures may be implemented quickly or with no notice, as this is a fluid situation. Business owners should begin thinking about modifying operations and hours. Some may even be asked to close temporarily. The task force was formed between health officials and local business owners to develop more guidance in the event of any closures. And although Cascade County has not made any official restrictions yet, some restaurants have announced changes to help with social distancing. We have seen multiple restaurants in town offering different options to try to help people with social distancing. Some are offering to-go options such as the Celtic Cowboy and Ed Bar. Some have opened the option for curbside pickup, including Crooked Tree and Mrs. Wright's Pasties. And quite a few restaurants have announced that they will be closed for dine-in services, but still offering to-go options. Those include all 3 Howard's Pizza locations, Teriyaki Madness, 5 on Black, and Smoked American Barbecue. Twisted Pretzel and Orange Julius have decided to close in the Holiday Village Mall. This is not an all-exclusive or inclusive list, I must say. If you want to know if a specific restaurant has changed from their normal practices, we urge you to call ahead. You can find more information on our websites. Well, one question we've been hearing is, what is the difference, or is there one, between the flu and coronavirus? And why has coronavirus had a bigger impact than the flu when there are fewer cases? MTN's Matt Holzaffel dives into the differences between the symptoms and some of the fears surrounding both viruses.
There are between 9 million and 45 million cases of the flu every year in the United States alone. As of the CDC's last update, there are now just over 4,000 cases of COVID-19 or coronavirus in the U.S. This begs the question, why is there so much more fear about COVID-19 than there is about the flu? The truth is, it's more about what we don't know than what we do.
They've seen the impact this disease is having on other countries. There's still so much we don't know about COVID-19, and that's why we urge you to take whatever steps you are necessary to protect your health and the health of those around you.
The numbers may not be close, but the big equalizer is a vaccine.
There's currently testing going on looking at COVID-19 antiviral medications. There's already some that address flu, so that is one other key difference. There's no vaccine for COVID, however, again, something that is being looked at and being researched and kind of encouraged to move very quickly.
At a time when coronavirus is the hottest topic in the world, Tricia says that treatment for the flu is not being pushed to the side.
The concern is that hospitals won't be able to deal with that. Currently in Cascade County, we haven't had that issue. People are still being able to be tested and treated for the influenza.
The main similarities are the symptoms. Fever, cough, body aches, and several others overlap between the flu and COVID-19. Both can be spread from person to person through droplets in the air, and neither virus is treatable with antibiotics. The main difference is the vaccine, the current ability to cure each virus, and the numbers. Matt Holzaffel, MTN News.
Thanks, Matt. And the Great Falls Clinic says that they're separating sick patients from well patients. A 24/7 coronavirus helpline has been implemented. They're asking people to call ahead before visiting the clinic. If you have questions about coronavirus, there is a helpline number available. If lines are busy, leave a message with a callback number starting today. All patients, visitors, vendors, and staff will be screened every day they enter a Great Falls Clinic facility. You can read more from the clinic on our websites. Well, at a press conference late Tuesday afternoon, Governor Steve Bullock announced one of the cases of the virus is connected to a March 5th Board of Regents meeting. He's urging anyone at that meeting to quarantine and get tested. The governor also announced new measures aimed at stopping the spread of coronavirus. First, employees displaced due to COVID-19 related illnesses, family care, or business closures are immediately eligible for unemployment insurance benefits. The governor says that the requirement to apply for jobs weekly is waived as long as employees stay in contact with and plan to return to their current employer. Small businesses are also now eligible for SBA loans, and the state will cover testing costs for uninsured Montanans.